Hello. So, welcome. This is a seminar put on by Synapse Center for Health and Healing. We're going to talk about natural remedies for the cold, flu, and COVID season. So, thank you for joining. So, first of all, what does the immune system do? Well, in layman terms, it fights the bad guys. Just as a little side note, it fights the bad guys and it does a good job if it's kept in check. If it gets out of check, we start to have things like autoimmunity or disease, okay? So the first thing I'm gonna start talking about is an ounce of prevention is worth a pound of cure. This is the obvious that might not seem so obvious. So we're gonna start with just natural lifestyle things to keep you healthy. Let's keep it simple. Start with being healthy. Eat your vitamins and minerals. That's the best way to get them. Drink water. Keep mental health in check. Sleep right. Exercise. Keep your gut healthy. And deal with underlying health issues. So we're going to dive a little bit into each of these. The first one is eating right. So I love the anti-inflammatory diet, aka the Mediterranean diet. It's my favorite diet. We use it a lot for hormone patients, but also in general health. So we like to just encourage getting your vitamins and minerals through your diet. Why? Because I can give you vitamin C or just vitamin D, and that's great. There's lots of research on what that does, but you don't get the synergetic effects of that. The problem with today, though, is a lot of our food and our soil is just depleted from a lot of this, so it's difficult sometimes to get a good amount. But if you're getting good, healthy, organic vegetables, this is the best way to get your nutrients. We're still learning a lot about just the synergetic effects and all the different phytonutrients that are in just food. And so, like I said, you can just give vitamin C, but you probably are gonna miss the added benefits of everything that's in the food itself, okay? So yes, just eating it. Try and sneak in your garlic, squeeze some lemon in your water, eat your oranges. It's a great way to get it. So what to focus on? So shoot for 4 to 6 organic veggies per day. So like I mentioned, just sneak in some lemon and garlic here and there. For this diet, you want to try and keep sugars or added sugars, more specifically, to 25 grams or less per day. Read your labels. It's pretty easy to reach this number. I always tell my patients, look at a yogurt container. There's 21 grams of sugar right there if you get the wrong kind. If you just look, you can get one that maybe has just 9 grams of sugar, so you can do a little bit better. I also have patients oftentimes being like, well, I don't eat sugar, but I get a Starbucks every day. And I was looking up what a grande pumpkin spice latte has, and there's 50 grams of sugar to that, just that. I think it was like 390 calories. So it sneaks in. And why that's important? Well, so there we go. Oops, skipped. Oops, 1 second. I'm frozen. But while this is coming up again, why that's important is sugar is inflammatory. So that's going to cause an issue with the immune system. Having too much weight, having too much fat, that's inflammatory. So it's just not good for the immune system. We are going to just talk about some simple things that you can also add in and make at home to help the immune system. So one thing is elderberry syrup and elderberry gummies. You can buy these, but if you want to have a little home project, you can also make them. And so we've got a little list here. Fire cider is another fun thing that you can do. I don't know, Nelly, do you want to come up and talk about fire cider a little bit, or like the ingredients? No? So it's just a hodgepodge of things that you make ahead of time. What's in it?
Yeah, pretty much a bunch of spicy foods, honestly. A lot of sulfur-based foods as well. So you have some onion and garlic, some warming herbs, so things like turmeric, a little bit of cinnamon, depending on what your flavor, what your palate is like.
Yeah.
And you pretty much let it stew in apple cider vinegar for a month. And then you filter it all out and you use that apple cider vinegar. Some people just take shots of it. They'll do like anywhere from 1 to 2 ounces a day.
Yeah.
Some people also mix it with like oils and things like that and use it for salad dressings. They use it in soup for extra flavor, sauces.
Yeah.
But then you get all those nutrients from those vegetables that you added like kind of perfused into the vinegar itself.
So it's just another thing to just really keep the immune system healthy. The other thing we're going to talk about is drinking enough water. So your immune system needs to be well hydrated to move places. So you can kind of think of it as being stuck in mud versus being in a flowing river. Like, which one can you move faster in? And your immune cells are like that as well. Your immune cells are in your lymph fluid, they're in your blood, and they need to be transported to the area where there's an infection. And so you need to be well hydrated for this to happen. So we always recommend drinking at least half your body weight in ounces per day. Filtering your water is a good idea, whether you're city or well. But when you do that, some of the minerals get depleted, and so that's not great. So remineralizing the water with something like BLK drops, that's a brand, but there's a lot of them out there. The BLK drops are humic and fulvic acid. This is something that vegetables actually, or plants, make when they pull up minerals and mix it with water. And so when you eat the vegetables, you get this as well, but that is something that you can remineralize with. So stress reduction. This is really important as well for the immune system. High cortisol is immune system suppressing. So prayer and meditation are like bicep curls for the frontal lobes, which are your big, higher areas of learning. And those areas actually control sympathetic output, which sympathetics is what stresses you out, and that is what leads to cortisol release, and that can suppress your immune system. So just even doing 10 minutes a day, get yourself an app to kind of remind yourself, have guided meditation, pray. It does have to be kind of quiet time. You can't just pray on the go, which is great too, but it won't do exactly the same thing. Another thing I like to do is breath work. This is a biohack for your body. So it takes you out of that sympathetic stressor and into your parasympathetic, which is your rest and digest nervous system. So just taking 2-minute breaks throughout the day, like especially after working out, if you have a hard workout, just pausing for 2 minutes, don't move, don't stretch, just breathe. That's one way to just kind of relax the nervous system. Because if you work out really hard, you're going to just kind of stay in that amped up zone all throughout the day. If you have a stressful life, just taking this 2-minute break can really calm things down. Another, not just breathing, but being systematic about it, is square breathing. So breathing in for 4 counts, hold for 4 counts, breathe out for 4 counts, and hold for 4 counts. And just doing that for 4 minutes or 2 minutes or so is another just great practice to kind of get you calmed down a little bit. Great to do it at night before bed too, gets you ready for bed. Speaking of getting ready to bed, is you have to sleep right to keep the immune system healthy. So practicing some healthy sleep hygiene. So that would include going to bed every night at the same time, stopping your screen time 1 hour before bed, adding blue blocker glasses into your daily routine is a good idea. You can actually change settings on your TV and phone and computer to block the light, the blue light coming out. Try not to eat sugars close to bedtime. That can spike your blood sugar and crash you, increase cortisol, wake you up. And then leave your worries for the next day. A nice little trick to this is have a little pretend jar in your brain and put all your worries in the jar, seal it up, put it on a shelf, and say, I will open you tomorrow. It's nice, it actually does a good job with that. And then fixing bladder issues. We've got some techniques here that can help with that too. So you're not getting woken up with bladder pain. Exercise is the next thing we'll talk about. Exercise, as a functional neurologist, I love exercise. It's my favorite thing after eating healthy, is exercising. Why that is one, it moves your lymph system around. Okay, moving your muscles pumps the blood, pumps your lymph around, helps with detoxification. So it's really great for that. Also, it's just when you move your body, you stimulate little proprioceptors in your joints. That proprioception goes into your cerebellum, up to your frontal lobes again, activates them, just like prayer and meditation, plumps up your frontal lobes, and helps calm down that stress response, boosts the immune system. Also, helps with balancing blood sugar. which can help reduce inflammation as well. You don't need insulin to take glucose or sugar into a working muscle cell. And so that's one way to kind of drop the blood sugar down a little bit. And it lowers your cortisol in the long term. You can overdo it. You know, if you stress yourself out too much with exercise, that's not good either. But, you know, you'd have to be either compromised physically and then even a little bit of exercise can do that for some people. But if you're generally healthy, like, you're not going to stress it out too much doing just general exercise. And kind of making a point there to take that 2-minute break. The best time to exercise is in the morning. That goes with the circadian rhythm. Your cortisol is a little higher in the morning as you wake up, and exercise also spikes your cortisol. So you want to do it in the morning so then you kind of calm down, get ready for sleep in the nighttime. A good goal, according to the American Heart Association, is shooting for 30 minutes of moderate intensity exercise 5 times per week. So now getting into the gut. So after your skin, your gut, or mucosa in general, like the coatings inside your nose and in your throats, this is your first line of defense, okay? So gut health matters. Your IgA antibodies are there. 90% of your immune system is located in your gut. A few things to kind of take note on is make sure you're having a daily bowel movement. If you're not, if you're constipated, that allows for a lot of the toxins to be reabsorbed. You can't detox properly and it can cause some health issues. And there's some things that you can do to get that moving. Talk to us if you're having any bloating, gas, constipation, diarrhea, heartburn. Those are all signs that your gut is not doing great, and so we can help you with that as well. We do order something called the Gut Zoomer, which is a stool test that gives us a lot of good information about how the gut's doing. And then avoid sugars. It feeds the bad guys. We don't want the bad guys fed in the gut. We want to feed the good guys with the fruits and veggies. Collagen supplements and bone collagen broths are another great way to kind of keep the lining of the intestinal system doing healthy or being healthy. And then again, eating your fruits and veggies feeds the healthy bacteria, keeps the right pH in the intestinal system. You need to have the right pH to allow good things to grow and bad things not to grow. So we're kind of focusing on that. The last thing for just general health, lifestyle things is fixing underlying health concerns. So hidden infections can really affect the immune system. So if you like have a sinus infection that's just hiding and chronically there, if you have like a chronic postnasal drip, we can test for infection in the sinuses with a Marcon's test, something that we do here in the office. If it's there, then we can address it and clear things up. Then that can stop kind of overstimulating the immune system. Things like latent EBV, Lyme infections, co-infections with Lyme, mold, mycotoxins, tooth infections. Those are some common things that we see here that can overstimulate or cause issues with the immune system. So now we're going to jump into COVID specifically. So who is more at risk of complications from COVID? So people over the age of 75, males more than females, people who are obese, type A over O blood types, so type A's are more susceptible, smoking, diabetes, active cancer, chronic kidney disease, cardiovascular diseases, arterial disease, heart failure, hypertension, respiratory diseases like chronic obstructive pulmonary disease, some other things listed there, liver diseases, active cirrhosis, immunodeficiency on steroids, immunosuppressants, 5-alpha reductase pathway, that's a hormonal thing that if you're going down a certain detox pathway, makes you a little bit more susceptible to the effects. I've had this in the office. And then dementia. We do run just a basic, it's a pretty comprehensive blood panel to assess for risks. So looking at like lipid levels, infection or inflammatory markers, blood glucose levels, those are vitamin D levels, B, just to name a few are in the panel so we can kind of address issues if they're found. So very important when it comes to COVID is fixing signs of metabolic syndrome. And so this would be, if we ran the labs or if you know this already, fixing dyslipidemia, so lipid levels being off in the blood, fixing blood sugar dysregulation, and then just getting to a healthy weight. So kind of talking like we mentioned earlier, the sugar causes inflammation and the fat causes inflammation, so we don't want that. So COVID-specific protocols. Just to make notes, we do have a nurse practitioner on staff who you can meet with and discuss if prescriptions like ivermectin would be a benefit to you. There are prevention protocols for that and also treatment protocols. And we're going to get into the supplements and a little bit of the medication here now. So this is just a list of COVID prevention protocols. This is taken right from the Frontline Doctors website. We're going to talk a little bit about some ideas also. So the first thing is the idea with zinc. So zinc is a good thing to fight infection. They're recommending 30 to 40 milligrams daily. However, you can get an imbalance of zinc and copper taking zinc every day. And so we have a supplement called zinc piconolate that has some copper in it. So if taking it long term, that's a good option. Taking it short term though, just straight zinc would be fine. Melatonin, mouthwash 3 times per day with an antiseptic antimicrobial mouthwash. Now this can be potentially helpful if you have an active infection or exposure. However, we would say that maybe not the best idea to really damage the natural flora of your mouth and throat. And so kind of differing opinions of that, whether it would be good or not. We're kind of talked about it, more of the proponent of encouraging healthy bacteria in the mouth instead of killing them off to help fight the infection. Steam inhalation once per day. You can use natural essential oils like lavender, thyme, peppermint, cinnamon, eucalyptus, and sage. And then taking vitamin D, very important. People who have a good level of vitamin D are handling COVID much better. We want to keep levels above 50 if you get checked, okay? Curcumin, it's a great anti-inflammatory, 500 milligrams twice daily. Vitamin C, of course, 500 to 1,000 milligrams twice daily. And then quercetin, just to make a note, there can be some interactions with ivermectin, so you're just not supposed to take them at the same time of day, okay? And then probiotics. They're finding low levels of the bifidobacterium may dispose a person to COVID-19. So getting a probiotic, specifically having that in it, would be a good idea. And then there's a post-exposure prevention. So if you know that you've been around someone in close proximity who had COVID, this would be the protocol. It's very similar to the prevention, except for some of the doses are a little bit increased. And so we do have all of this information in the office. Having an appointment would be a good way to kind of sit down and go over this and talk about some different options there. And then there's also early COVID support. Always consult a healthcare provider before starting any kind of treatment. And so this is if you actually have COVID, again, very similar to the prevention and the exposure prevention protocols, but it's just a little bit increase in some of the amounts. They've also added on this protocol some B-complex vitamins and some fish oils. If you do get COVID, a good thing to do is monitor your oxygen saturation rate, and if it drops below 94, that's a good time to go in, okay? You can have some asymptomatic hypoxia, so you might not know that you're low on oxygen, and if it gets too bad, it's just harder to treat at that time. So the earlier you get in, the better. So you can get yourself a home pulse oximeter. They're not expensive, and you can just have it on hand, checking it throughout the day. So a lot of people might not know this, is that COVID can flare Lyme and EBV symptoms. So if you've had exposure and maybe you don't know it, if you're having lots of joint pain, or if you know that you've had these illnesses in the past, you might notice that you get flared. A lot of long haul COVID patients are found to have these underlying infections as well. Also, it can cause things like anxiety, other mental health issues. So if you're noticing that you're struggling with some of this post-COVID, it could be related. It also has been associated with Parkinson's and Alzheimer's. In our office, we are seeing lots of elevations in fibrinogen. This is a clotting factor, and so we do keep that in check. We do have some natural supplements that can help support anticoagulation. So the NATO NSK Mega is one that we use. I also really like to focus on anti-inflammatory herbs. We'll talk about some of those later on. So ivermectin, straight from the Frontline Doctor's website. I'll just mention here, like, as chiropractors, I can't recommend or prescribe medications. This is for informational purposes only. You do need to see a trained medical provider for consultation. Bonnie, our nurse practitioner, is providing consults, so that's an option for you. Ivermectin has been used for decades for parasite infections, and it's found to be very safe. Research has shown it to be both antiviral and anti-inflammatory also, and antibacterial. It works by preventing viruses from entering the cell nucleus and replicating its genetics. It is FDA approved. And then Bonnie, do you want to talk any more about that?
I would just add that, not everybody needs to have ivermectin. I think when we're doing, it's important to realize getting healthy from the outset before cold and flu season is probably even more important. And most of the time our bodies can fight that off without needing the prescription. But we're here for you if you need it.
Yeah, good, awesome. Also, see your medical provider early, not late, okay? So the pulmonary phase is characterized by prolonged immune dysregulation, a pulmonary microvascular injury with activation of clotting and procoagulant state together with the characteristics of an organizing pneumonia. This phase is treatable, and it is inappropriate, I'll say it again, it is inappropriate to limit therapy to supportive care alone. As patients progress down this pulmonary cascade, the disease becomes more difficult to reverse. Early treatment is essential to a good outcome. So just want to keep that in mind. So now we're going to go into what specific supplements might help support a strong immune system. And so a lot of these you'll see are what's listed for the COVID protocols, okay? So vitamin D. So why do we take it? Vitamin D, when it comes to the immune system, modulates the innate and adaptive immune cells. That's your B cells, T cells, and antigen-presenting cells. This is also why we give it for autoimmunity, because it modulates, which means it just makes it kind of in the middle, kind of works and functions properly. I usually recommend 5,000 IUs per day as a good maintenance. If you do get your levels checked and you are low, sometimes we'll do a period of 10,000 per day. I usually do about 2 to 3 weeks of that and then go down to a maintenance dose. Doctors might have differing protocols, okay? So again, seeing your provider is the best idea. Vitamin C, what does it do for us? So it is a powerful antioxidant. This means it takes nasty free radicals produced in the body and neutralizes them before they can cause damage. It is also a cofactor. This means it is needed to make chemical reactions in the immune system work properly. So this again, good to take on a daily basis. These are some options. These are all from Nutridyne, or available through Nutridyne. So there's a liposomal. Liposomal C just makes it more absorbable. You absorb it through the mouth and tongue, and so you kind of can bypass the intestinal system a little bit if there's some dysfunction there. The chewable also gets the digestion process going, and then there's some capsules there. So there are some natural antiviral and antibacterial supplements as well. So biocidin is my personal favorite. I love this one. It comes in a throat spray, liquid, capsules. The throat spray gets kind of directly, obviously if you're having like a little sore throat, some sinus issues, that can kind of get back there. The liquid also, you can kind of gargle with it, but that one is easily absorbable. And then capsule I usually like to use more for digestive issues, because it gets down into the intestinal system a little bit. And then not listed, there's also liposomal biocidin, which again gets more absorbed, goes more systemically. And so when I first feel a little tickle in the back of the throat, start to notice kids coughing a little bit, I love just adding this in as kind of getting on top of it before it gets too bad. But this is a good one. Andrographis is another antiviral and antibacterial. I'll make note with andrographis though, it has the potential, if you are a Lyme patient, to cause Lyme to go into cyst form. Biocide, on the other hand, claims to not cause the same issue, but andrographis can be used as an antiviral, antibacterial option. Immune resilience from Nutridyne is something that is a supplement that has andrographis in it, and I love it because it's got all of these other things, quercetin and ginseng, turmeric, elderberry, all of that listed, and you can see those were listed on the COVID protocol. So this is a nice way to kind of hit a number of those. I've had a number of patients do this and do really well with COVID. Even compromised patients or highly compromised patients are doing well. Not to say for sure that's why, but just to say they are. Iodine is another option. You can take a few drops and coat the back of your throat if you start to feel a little sick back there. You can also coat a Q-tip and swab the inside of your nares twice per day. You can do this if you've had COVID exposure or know that you're starting to get a little sick. This though as well, wouldn't want to use kind of long term because it will kill off your natural bacteria as well. And so want to use it more for when you're just starting to feel sick or are sick. Dynamic fruits and greens. This one is specific for immune support. There's also just dynamic fruits and greens. Love this one too. Kids can take this one. It's a good way to get lots of antioxidants. You can see this list here of the ingredients. It's got some zinc, it's got quercetin in it, it's got elderberry, a lot of things that we have listed, and just a bunch of other antioxidants. And so I personally use this as well with my kids and myself when we start to feel sick and just to stay healthy too. Something I didn't mention earlier with the vitamin D, that liquid or micellized form is something that's really easy to give kids as well. This is dynamic multi-collagen. I use this every day. It has a lot of same ingredients as the dynamic fruits and greens with the added benefit of collagen. So it helps keep that intestinal system healthy. Also helps your skin and muscles. So it's one of my favorites. And then this is a horrible picture, but B complex is a good B complex that you can get from Nutridyne as well. We use this often with patients. And then this is the NATO NSK Mega. This helps keep your fibrinogen levels at a healthy level. I listed some options for kids. This is Suppies. This is also from Nutridyne, or available through Nutridyne. It's a kid's chewable multivitamin. My kids have an easy time taking this and they enjoy kind of like a piece of candy. Also, there's Suppies probiotic that's chewable. And then I also use the multi-powder with my kids as a general multivitamin as a way to, it's a liquid and it just tastes kind of like juice, to get a vitamin in with them. And then I also have the Suppies probiotic liquid in there. Again, you can add this to a drink, add it to food, just drop it on the tongue. My kids have no problem taking it also. And that's another thing that I'll use as a probiotic liquid when I start to feel a little sick, just to coat, again, encourage that healthy bacteria in the mucosa to fight infection. And then this is Argentine 23. This is a silver nasal spray. So if you're having sinus congestion, this is something that we'll use to help clear that. This is some of the options for the gargling and nasal spray as well from the frontline doctors. And then other things. We do some nebulizing in protocols here, and so that would be best to see a provider to get the complete protocol for this. But we are using glutathione and or iodine if there's lots of residual lung issues after COVID, for example, or having problems clearing things from the upper respiratory tract. Dry brushing. So I think Dr. Natalie is going to show a little bit on how to do some dry brushing and also some lymph massage. And so dry brushing is something that we use not just to help when you're sick, but also just for good health. It gets the lymph moving. You do it before showering, and Dr. Natalie is going to talk a little bit about that.
Yeah, so before I will have my patients do dry brushing. So the purpose of dry brushing is really to move the lymph system around and get that fluid going to help with the detoxification process. But there's 3 different layers of lymph, right? So there's the most superficial layer, which is accomplished by moving gets moved with dry brushing. And then there's that intermediate layer, and then there's a deep layer. So the superficial layer has to go all the way down into the deep layer in order for it to actually move and go somewhere to get detoxed out. So I will have my patients start with a lymph node massage first. So usually there's 6 places. You wanna go above and below the clavicle. You wanna go behind the angle of the jaw, right in front of that lobe of the earlobe. Then we wanna start at the pec. So right where that pec attaches in the front of the shoulder. Deep in the abdomen, above and below the belly button, there's some big lymph nodes there, right around the crease of the groin, and then right behind the knee. And I usually say 10 to 30 seconds in each of those spots, kind of gets those big like meeting points of those lymph vessels open before you jump into dry brushing. I'm gonna use Dr. Amber's dry brush here. So one tip about dry brushing is you always wanna go from the peripheral up into the central. So you wanna start at like the feet or the hands and kind of move your way towards the heart to help that fluid kind of come central in order to get processed through, taken to the liver and dumped into that heart area. So you wanna go in long lines, except for when you go around joints or the abdomen, then you go a little bit more circular. It doesn't take a whole lot of pressure. We just need very light movement. Any kind of stimulation will move that most superficial layer of the lymph.
Awesome, thank you.
Perfect, yeah.
Yeah, so just doing that, I usually tell people to doing it just before a shower. Did you mention that? Yeah.
No, I didn't.
Is just a good time to do it. Awesome. So also Epsom salt baths are something that can just be really helpful for supporting detoxification, keeping you healthy. Also, it's very relaxing. And then there's sinus acupressure points. So we'll demonstrate that. Oftentimes I'll use tapping. So I'm gonna go through just the points here. I don't use all of these points all the time, but you can also do like a gentle pressure and just massage. But if you just take your 2 fingers and tap, so right underneath your pupil, on your cheek there, you might find a little sensitive spot, especially if you are having some congestion, it might feel really sensitive. And you just tap for about 15 seconds, okay? And then you move on right to the corner, inside corner of your eyebrow. Again, might be a little sensitive. And then on the outside corners of the eyebrows, right above the eyebrows, kind of in the middle of your forehead on both sides. Yeah. And then right kind of in the crease of your nose there. It's another good spot. Okay. Those are kind of the key spots that I work on, and you can just do multiple rounds. Kind of just tapping. What this does, it just kind of brings, from acupuncture standpoint, energy to the area and gets energy moving. But it also just kind of shakes things up, helps with getting things dislodged, bringing blood flow to the area. You can also do just like a gentle like spreading of the nostrils just to kind of get things moving that way. In following some of the lymph massage, you can also kind of just pull gently down on the neck just to kind of get the lymph moving away from the ear, help with drainage a little bit, okay? So those are some great things to do at home. You can add in a little peppermint oil too to this, just to kind of open things up. Just put a little bit on your hands and do the tapping, okay? Okay, gua sha. So I have a really good success with gua sha. I use this a lot for my mold and Lyme patients to get the lymph moving, getting great results with it. But you can also use it when you're starting to have a little upper respiratory issue, okay? And so all it is a little scraping. I don't know if someone wants to come in. Maybe Gail, you have a sweater on.
Yeah.
That might be the easiest. So maybe come and sit over and I'll show the back. So I use just a little bit of motion just to kind of get things going. And then just go ahead and hold your hair to the side there. Good. And really focusing kind of just along the spine. With this, you might get a little redness. It's called tichia, and it might cause a little bruising along there. It's great for getting muscles to relax too, breaking up adhesions in the muscles, but for the immune system, we're just trying to really move the lymph. Especially on the left side, the lymph system is different from the 2 sides and how it drains. See a lot of congestion in the left with compromised patients and people who are sick. So just kind of moving that around would be good. Thank you.
Yes.
So yes, we do this in the office. This is something that you can come in for and get some treatment. Acupuncture is also a way that we use to stimulate the immune system and move lymph. So it does, one, it stimulates the brain, again, activates reduction in pain, and activates the frontal lobes, kind of for the things that we talked about earlier. It also strengthens the skin, and so that is a big defense of keeping the bad guys out, is keeping the skin nice and strong. It improves the lymph flow. It also draws blood to areas for improved healing. There's a protocol that I use called 4 Gates that really strengthens your constitution and prevents invaders that can cause infection. Also, obviously, where chiropractors get adjusted. So adjustments are all about the nervous system. Adjustments reduce pain, which lowers the cortisol level and can help improve sleep. All of these boost the immune system. When there is irritation or interference in the nervous system, information from your world that you're experiencing is distorted as it comes into the central nervous system. This will alter function. Your brain controls the immune system. Getting adjusted helps keep your nervous system functioning properly. So a lot of patients will come in when they first start feeling sick just to kind of get things tuned up, and can sometimes help ward off a full-blown infection. And then just some general other things to mention. You can try adding or ending a shower with a cold or cool rinse. This closes your pores and again kind of prevents or helps prevent invasion. Drinking warm tea kind of just helps keep the mucosa moisturized or moist, so it can do its job in catching the infection as it comes in before it gets too far. You can use a humidifier. Sometimes we get sinus issues because it just gets so dry, so we produce more mucus. You just have to be careful with this, that you don't have like mold in the humidifier or get too moist in the house so you develop a mold issue. Raw honey to coat the throat. There's some little blends that you can do where you add other things to it and kind of lick the honey for a period of time to help it coat. The honey helps the different ingredients kind of stick to the back of the throat. And then just as a reminder, coughing and fever are not always bad as long as they don't get too bad. This is just your natural immunity. Coughing gets the invaders out, fever kills them off. So not always a good idea just to suppress that, but of course if it gets to be too bad, that's when problems come in, okay? I'm also a fan of sun lamps in the wintertime. Using it for about 10 to 20 minutes daily in the morning when you first wake up. Sit so your face is 10 inches from the unit is how it needs to be done. If it's too far away, you're not going to get the benefits from it. I use the Verilux option, has the right kind of light, and this just helps with the circadian rhythm, kind of fights off seasonal depression a little bit. So we can go through and ask some questions.